Hello, good evening, everybody. This is Erica from EG Wellness, Body and Mind Transformations, and I wanted to talk today about pelvic floor health and how it relates to obesity. Since I do work with weight loss and primarily at the mind and body, I would like to at least address the pelvic floor for people who are peeing their pants. So, those ladies out there who are jumping, sneezing, or coughing and they're leaking, this is the story for you. This does not have to be normal. The more people I talk to, because I am a PT assistant, are people who think that it is normal to leak while you're jumping, going from a sit to stand, sneezing, coughing, any kind of exercising. It doesn't have to be that way. Just because you gave birth or you're overweight does not mean you could have to leak. So this is why this is really important to be addressed. The pelvic floor muscles are muscles, right? They're just like the rest of our body that need attention. Just because it's down there does not mean it doesn't need some attention, right? So if you went through, did childbirth, doesn't even have to be natural childbirth, the hormones of the body change your muscles, and that changes the way your bladder and your muscles work around your pelvis. So when it comes to weight, overweight and obese women are at a much higher risk for developing a lower urinary tract symptoms such as overactive bladder and urinary incontinence. So that's the not be able to hold it. Okay. Stress urinary incontinence or the involuntary loss of urine on exertion. Now, this is what I was talking about: the jumping, the sneezing, the coughing, the leaking when you're trying to do normal things, right? Okay, that's the thing that I really want to touch base on. So research shows that overweight people lose weight as little as 5 to 8% of their body weight can decrease the incontinence frequency by 50%. So you don't have to continue to feel this way. So the more overweight you are, the more chances you have this problem and nobody's talking about it. I see it in the clinic because I used to see a lot of people who, like, they were mothers, right? They had babies, and then there's the overweight people who talk about how they're having issues down there. It doesn't need to be that way. So obesity has been long correlated with chronic pain syndrome due to increased inflammation and added stress to joints. There are joints in your pelvic area. It is no different than any other joint, okay? Everything that has a joint can have inflammation problems and the consequences from that. So another pelvic floor issue is prolapse. Okay, let me just quick check to see if somebody is on. Okay, another pelvic issue is prolapse, which can occur when the tissue that supports our pelvic organs, such as the bladder or the uterus, are stretched, leading those organs to drop down, pressing against the wall of our lady bits. That doesn't sound pleasant at all, right? So think about that. If you have more weight in your abdominal area too, that's going to put more pressure on your bladder. Right? It changes the way your pelvis is too. So we'll talk about that here in a second. So the way poor posture relates to any kind of pelvic floor issues is, everything is in a pulley system, right? So I've talked about, maybe not in my women's group or in here, but I strongly believe in making sure that the pelvis area is very stabilized and strong for multiple reasons. This is the center of all your movement. So if you have muscles that are too tight in the front and overstretched in the back, your pelvis is going to dump forward. Okay, so the pelvis can either have an anterior tilt or a posterior tilt. But you want your pelvis to be in neutral, and anytime that pelvis is out of neutral, it can cause problems on your lower back and on your pelvic floor. So if you have bad posture, what happens is your body dumps forward, which then causes the pelvis to roll backwards. And if you wear heels, it makes the pelvis roll forward. Anytime there's an imbalance of that neutral spine or neutral pelvis, causes problems with muscle lengthening. So if a muscle is either too tight or too overstretched, the muscle can't function properly. So again, the pelvic area is no different. Okay, so like I said, it gives you a visual example of what's happening when your body's in certain positions and how much it affects your pelvic area. And that also direct relates to lower back pain, because again, your pelvis is moving in a direction that it's not supposed to be able to stay in that position. So just to kind of jump on a very quick overview of pelvic health. So again, it's going to be good posture for correct pelvic alignment. We're going to strengthen and stretch the muscles of the hip and pelvis. And I talked a little bit how important that is and why that the muscles are pulling on the pelvis bone. Right? Everything's connected to bone, so the bone moves the muscles. The muscles or the bones just don't move by themselves. If you lose weight, you get improvements in your pelvic floor. Okay, and then use of a biofeedback machine. That thing is amazing. Okay, so if you want to learn more about pelvic health and the amazing at-home solution to stop peeing in your pants, hop on over to the women's group that is listed in the comments or the description on the live area. So I'm going to have more information about pelvic health in there, and also something that can help you that you can do at home, which doesn't, I mean, it's always good to be evaluated by a physical therapist just to make sure there isn't, so there's two different things that can happen. You can either have underactive or overactive muscles. So the thing that works the best with this is going to be underactive muscles, which are the things that I'm talking about. Usually people who are overweight or had a baby have underactive muscles, but not always the case. This is kind of where Kegels come into play, but most people do them wrong. And if Kegels, if you've ever tried Kegels in the past and they hurt you, then it's not the program for you, because that means you have overtone in your pelvic area, and then you would need to have some manual work done, which is as weird as that sounds. Sometimes it's the only way that you can do that. But for the ladies who are doing the jumping, coughing, sneezing, and are leaking, that is going to be the weak muscles. So that's where this device and these exercises and techniques will work for you. So hop on over to the women's group and get some more information there. Again, the link is over in the description. And also, if you'd ever like to give me a quick clarity call, just 15 minutes, just to talk about any kind of weight loss issues that you are having. It's just a chat. It's nothing for sale. I just want to talk to you to see if I can help you or if we can find some holes that are in your current program or plan, just to kind of get you set up for the new year. So thank you for listening. Please comment below if you have any questions in specific about pelvic floor health or anything like that. But again, have a great night. Bye-bye.